there are more African American men in prison, jail, on probation, or parole than were enslaved in 1850. That's a statistic that you just don't really ever forget. And really it's more than a statistic for me, it's a story, and it tells a lot. And I ask myself, why is that? Why is that true? The federal prison population since 1980 has grown by 721%, thanks to Reagan's vision for the war on drugs. And nationally, crime is down, and many people point to that and say, so something good is happening. Yes, violent crime is down, but only 13% of federal prisoners are in for violent crime. The vast majority are in, 72% are in for nonviolent offenses and have no prior history of violence. 56% of federal offenders are in for a nonviolent drug offense. 56%. And that's what's constituted this huge explosion of our prison population. And yet, rates of illicit drug use have stayed the same. And recently, they've actually gone up a little. Mostly due to marijuana. Today, fewer teens smoke cigarettes than smoke marijuana. And yet, cigarettes are legal and marijuana is illegal. So these are the realities. And when drug use has risen, when blacks and Hispanics are arrested at disproportionately high rates for drug offenses, and yet blacks and whites use drugs at the same rate, we have to ask ourselves, why is this policy in place that has led us to this alarming statistic that more African American men are under the supervision of the criminal justice system than were enslaved in 1850? Rhode Island voters certainly want to change. The majority of Rhode Islanders support legalization of marijuana and a public health approach to drug policy in general. The majority of Americans support the legalization of marijuana and a public health approach to drug policy in general. And yet, our representatives have, for the most part, done nothing. And with that, I would like to introduce Rhode Island State Representative Scott Slater.
Good evening. The topic of marijuana policy is personal to me because of my father, Thomas C. Slater, who passed away 5 years ago. My dad was a state legislator, and one of his lasting achievements was establishing the Rhode Island medical marijuana program that has helped thousands of chronically ill patients find relief and improve their quality of life. I am proud to be part of the effort to build on my father's legacy of sensible marijuana policy. It's truly incredible to see everyone that's here tonight, from everyone that's here, so many people from our state who are passionate about this issue. Being part of Regulate Rhode Island Coalition has allowed me to see that support for marijuana policy reform spans virtually every ideological and political divide. It is extraordinarily rare for an issue to receive support from leaders of the Democratic, Republican, and Libertarian parties. I am happy to say that our previous achievements in the marijuana policy reform here in Rhode Island have gone quite well. We have one of the best marijuana programs in the country, medical, and no one goes to prison for possessing small amounts of marijuana since our decriminalization of small amounts. It's safe to say that the sky has not fallen as a result of these important life-saving policies. Now it's time for us to go one step further. By replacing the costly and ineffective policy of marijuana prohibition with a system to regulate marijuana for adult consumption. 4 states in our nation have already done this. Rhode Island has an opportunity to become the first East Coast state to regulate rather than prohibit marijuana. Instead of steering profits into an illicit marijuana industry controlled by criminals, we have an opportunity to create legitimate, tax-paying businesses that will bring jobs to our state and generate new revenue. In Colorado, they have created more than 10,000 jobs in growing legal marijuana economy. And they are using the revenue from marijuana sales to improve schools and to hire more nurses. I will certainly be working to convince my colleagues up at the State House and the General Assembly to take advantage of the window of opportunity we have here. Other states in New England are already considering establishing systems to regulate marijuana. And if we will not move forward soon, we could give our state a disadvantage in this. And if we do move forward, our state would have the advantage to attract new businesses to headquarter their operations here in our state. I thank all the panelists who are here with us today for being with us and for the knowledge and insights. And I thank you all for taking time to learn more about the important issue. I look forward to learning more myself. Thank you.
All right, we're going to get started here with our first panel. We have our moderator for our panel tonight is Jared Moffatt, who's the Executive Director of Regulate Rhode Island. Mason Tvert, Director of Communications at a Marijuana Policy Project and Co-Director of the 2012 Amendment 64 campaign in Colorado. Dr. David C. Lewis, the founder of Brown University's Center for Alcohol and Addiction Studies. James Vincent, President of the Providence Branch NAACP. And Elizabeth A. Connory, retired attorney and former Providence police officer. Thank you so much, everyone, again, for being here. Jared?
Thank you, Diego. I appreciate that wonderful introduction. We've got a lot of topics to cover here tonight with our panelists. I'm really excited to see such a great turnout and so much interest in this important issue. So the first topic that we're going to kind of talk about here on the panel is the origins and the history of marijuana prohibition, because it's not true that marijuana or cannabis has always been illegal. In fact, in history, it's actually a relatively recent phenomenon that we've seen an attempt to ban marijuana cultivation and distribution. So I want to start with you, Dr. Lewis, because I know that you wrote a paper actually back at the beginning of your career on the origins of drug prohibition laws. Can you speak on that a little bit?
Well, the marijuana prohibition was really part of a series of prohibitions which were all connected with prejudice of one kind or another. What we had at the turn of the century, not the turn of this century, but way back in the late 1800s to the early 1900s, was a situation where large numbers of middle-aged women were addicted to morphine. And eventually, some of that spread into other drugs and to street use. At the same time, there were many, many Chinese immigrants working on the railroads. And a lot of publicity about their smoking opium out on the West Coast. So the first wave of prohibition, which really set the pattern for what eventually was marijuana prohibition and led to the Harrison Act in 1914, was really a reaction against the Chinese immigrant and a very strong campaign that first started in the States and then was federalized in 1914 with the Harrison Act. And that's coincident with alcohol prohibition being considered as well. So the whole idea of prohibition was pretty much locked into place by this anti-Asian prejudice in the country. The next wave was the marijuana wave, and that happened with another immigrant issue on the Mexican-Texas border, and also the use of the drug, which is the use of marijuana by those immigrants, and the fear of lack of employment and real invasion by immigrants from Mexico. After some discussion, in 1937, the Marijuana Tax Act was passed, and that set the framework for what we're dealing with now. The last one was anti-black, anti-African American, was much more racist and much more spectacular. That came in two ways. The first was in the 20s about African Americans in the South being immune to bullets if they were under the influence of cocaine, but also better shots. So it was both things at once, and there's a very famous large piece in the middle of the page in the New York Times explaining how the Negro cocaine fiends could get away with this behavior. This kind of activity led to anti-cocaine laws. That was repeated with the crack cocaine disparity, which also had to do with the spread of crack cocaine from Wall Street into the suburbs of, into the inner city of color in New York and other cities.
So this is where we saw basically the emergence of this type of reefer madness, or this sort of sensationalizing. I've actually wondered if I could bring you in to the conversation, Jim, to talk a little bit about that history and also how this, how race has really intersected drug policy since the beginning, but also into the present.
Well, good doctor just explained that it began with the Chinese, moved to the Mexicans, and then finally to the Negro. So in each case, you're talking about a group of color that has alerted the United States that there's a problem or there's a plague that's coming upon us. So to me, it's very simple that it's all rooted in racism and xenophobia. Every bit of it, because I do believe everything that the doctor has said. And I just feel that, we might as well just come out in the open and just admit that some of this stuff is rooted in racism and it needs to be stopped. It has too much of an effect on not only communities of color, but all communities. All communities are being hurt by the fact that there's a racist element to all of this. Beginning with the Chinese, moving on to the Mexican, and then finally with the Negro, or the colored, or the black, or the African American, or whatever you want to call folks these days. But I find it unacceptable, and I'm glad that there's books like The New Jim Crow by Michelle Alexander that really shine a light on exactly how interrelated these things are in terms of race versus the marijuana prohibition.
Yeah, we will come back and touch on that in a little bit. So, Elizabeth, I want to bring you into the discussion because you were a police officer here in Providence from 1976 through 1982, which was really a period of time where it was kind of in the midst of some of the escalation of the war on drugs. I wonder if you could speak about your experience as a police officer, specifically as related to marijuana enforcement and other drug laws.
Well, when I joined in 1976, I was in the patrol division working nights, and quite frankly, marijuana prohibition enforcement was an extremely low priority amongst my contemporaries. It was not why anybody joins the police department, and there were more important and more interesting police work to be done. In addition to that, we knew that there were plainclothes units who were dedicated solely to the enforcement of the drug prohibition laws. So we just sort of let them do it, and good. But what we observed was that these units, they worked almost entirely in the disadvantaged minority neighborhoods, South Providence, the projects, and we never saw them up on the east side in the affluent areas over there, or the college campuses, and frankly, we were pretty sure there were drugs in the 70s, around and so even back then, we were really aware that this is not being enforced equitably at all, but that's where they focused their attention, and that was it. The other thing that I can certainly speak to is many of the calls that you go on when you work at night are disturbances, and I'm, 99.99% of the time, the root problem with those disturbances was alcohol. I have no recollection of ever going on a call where two potheads were beating each other up. So, and I think I remember it. So I'm pretty sure that never happened in the history of law enforcement. So, there you have it. We have, the legal drug causes a great deal of problems, and meanwhile, marijuana, we could pretty much ignore.
Well, that really segues nicely to bring Mason into the conversation. Mason, thank you for joining us all the way from Colorado. But you actually wrote a book on the topic of marijuana compared to alcohol. It's called Marijuana Safer Than Alcohol: Why Are We Driving People to Drink? So can you talk a little bit about the relative health effects, what the science tells us when we compare marijuana to alcohol?
Sure. Well, ultimately every objective study on marijuana has concluded that it is less harmful than alcohol. It's less addictive, it's less damaging to the body, and it is far less likely to contribute to violent or reckless behavior. If I had $1 for every time I've spoken to a police officer, a former police officer, who said the exact same thing about what typically inspired the calls to for service, I'd be a rich guy instead of a marijuana advocate. Ultimately, we know that marijuana in and of itself is relatively non-toxic. There's never been a confirmed marijuana overdose death in history. Unfortunately, when it comes to alcohol, we know all too well that in a single night, it is possible for someone to die purely from drinking. And that was really the inspiration behind the organization that I started in Colorado back in 2005, called Safer. Was we had 2 incidents on college campuses in which students simply drank to the point that they died. And we wanted to talk about the fact that if these students had been using marijuana, they obviously would not be dead. Yet we have laws and policies that steer people away from using marijuana and toward drinking. And now in an ideal world, no one would want to use alcohol or marijuana, maybe depending on who is not very ideal. But the fact remains that in the real world, these substances are out there, they're widely available, they're widely used, and yet we are incentivizing the use of a more harmful substance than someone might otherwise choose to use, and that's just bad public policy. So ultimately, we know that the public health costs associated with marijuana pale in comparison to those associated with alcohol and tobacco. According to one assessment that was done, came out of the British Columbia Mental Health Addiction Journal, found that the health costs associated with alcohol are more than 8 times greater than for marijuana. And a lot of the costs associated with marijuana are based on enforcement. They're not based on the actual harms of the substance. So there really isn't a good, compelling government interest in keeping this product away from adults when it comes to responsible use. Should the government be involved in regulating this product? Absolutely. Should the government perhaps be involved in encouraging people to be responsible in using this product? Absolutely. But there's really no rational reason why we should be punishing hundreds of thousands of adults every single year simply for using a substance that's less harmful than going out and having a couple cocktails or a couple beers while watching a football game. And that's really what needs to change here. And quite frankly, there is some evidence, there hasn't been a chance for enough to come out yet, but I'm very confident we'll see it, that marijuana will prove to be a substitute for alcohol for many people. And there will be adults who would prefer to make that safer choice. And we should not be discouraging people from making a safer choice if that's what they prefer.
Great, thank you, Mason. I kind of want to take that now to you, Dr. Lewis, to see, do you think Mason's basically right? What's the state of the science? We see a lot of studies about IQ and a lot of science out there. What's your take on all that?
I will, but, the microphone. But being a professor at Brown, I want to start with a couple of assignments, okay? I just want to make sure, if you haven't, and Jim referred to them. So this is the book that's required reading, called The New Jim Crow by Michelle Alexander. And that's where the opening line about more people being under judicial supervision in prison in the slavery period.
That we heard from Diego.
That you heard from Diego. So this really speaks about the major problem that exists with the drug war, independent of the relative risks. And I think the relative risk of alcohol to marijuana is pretty straightforward. One's very toxic and the biggest problem, both for the criminal justice system and for injury, and marijuana is in another category. So, but this is what's behind the civil liberties issue, and it's required reading. The second is a different take on the science and the medicine by Carl Hart, called High Price. And I think that's worth reading. Carl may, in some cases, overstate the way in which science is sometimes perverted to make the case against marijuana. On the other hand, it's good to know the things that prevent research from taking place, the fact that it's a Schedule I drug, which makes that hard, the fact that there's a marijuana farm and you have to have permission from the federal government to use its marijuana in NIH studies, and on and on. So this is a personal history of Carl, which is very instructive. The third assigned reading is the most powerful of all, and it's the TED Talk, which was chosen nationwide last week as the best TED Talk. And so if you Google TED Talk, T-E-D, in case you haven't seen the TED Talks before, TED Talk, Ethan Nadelmann, E-T-H-A-N, N-A-D-E-L-M-A-N-N, 2 N's. So if you Google TED Talk, Ethan Nadelmann, you'll see the most articulate comment about the problems caused by the drug war. Now, to answer your question. I think the science is important. It's sometimes pumped up by people that are afraid that somehow youthful attraction to marijuana will mushroom with decriminalization or legalization. Somehow the group of scientists that focuses on the research somehow misses the point that under our current criminal justice kind of mechanisms, we've done very little to contain the use of marijuana or the problems that do exist from the use of marijuana. So if you knew nothing about the science and the medical risks of marijuana, you would want to be looking for alternatives, for sure. Because the current use of the criminal justice system, whether it throws millions of people into jail or not, it certainly arrests hundreds of thousands of people for marijuana possession. So there's enough to look at for alternatives. The risks of marijuana are sometimes minimized by those that are trying to make the case for legalization. And I think that it's important not to minimize the risks. It's important to point out we've discovered a lot about youthful brains and the organization of brains over time, and that they're maturing over time, the plasticity that exists in the brain, and the kind of problems that can exist with heavy long-term marijuana use. So they're real. There's no reason to talk about marijuana as if it's a harmless substance. On the other hand, it's important to take those risks and line them up with what we're doing now, with the way we use marijuana enforcement in the criminal justice system. So from a public health standpoint and a medical standpoint, we acknowledge all the risks, and the medical profession shouldn't avoid the civil liberties part either. So how do we put the two together? Well, it's two separate issues. Understanding the civil liberties part, understanding the medical part. There's absolutely no reason to minimize the risks of marijuana. As a matter of fact, there's been a lot of attention to decrease cognitive function and intellectual function in the heavy users over time. And the IQ study is a good example, although it's a good example of science which is unsound. So the IQ study's gotten a lot of publicity. Head of NIMH, the NIDA, NIDA, Nora Volkoff keeps talking about your IQ going down by 6 or 8 points if you're heavily using marijuana. And then there's another study in the Proceedings of the National Academy of Science within the 6 months saying, well, that study doesn't really take into account socioeconomic factors. And you know that socioeconomic factors alone can have major, major influences on IQ. So would we throw out the study? Maybe, maybe not. There's a third study that was reported last month, actually October 21st. And that's from the University of London. And it is an interesting study that hasn't been published yet. And actually the chief investigator is a second-year PhD graduate student, so not one of the senior people. On the other hand, data is data. It's from a bigger database than the first study, which came from New England, of about 1,000. It's about 2,000. And in that study, the heavy marijuana users showed absolutely no difference in IQ. So now you have conflicting studies, and the answer is going to be, move ahead. On the other hand, that doesn't mean there aren't risks to marijuana use, because the latest study that was reported in Berlin by this graduate student, and we'll see what the publication is, also pointed out that the test scores that they take in the UK went down in the heavy user group. So there's something going on with long-time heavy marijuana use that needs to be straightened out. So that's my take of the science. And the medical profession sort of feels obligated to make all these scientific points, no matter what, and avoids all the civil liberties points that we're making. And you simply can't do that in making public policy.
Well, I want to turn to that a little bit now to talk about more of the policy, because we have seen a really just impressive shift in public opinion in recent years. The poll numbers have just gone up and up for people favoring ending prohibition. So I kind of want to just I know we want to leave time for questions. So I want to kind of go first to you, Jem, and ask. The NAACP is a member of the Regulated Rhode Island Coalition, but not only that, the New England Area Conference of the NAACP endorsed our initiative here. Do you mind speaking a little bit what motivated them to do that?
Well, actually, you did. I met with you, and I wasn't quite sure exactly why you wanted to meet with me. And you said, this whole thing is a social justice issue. And I said, well, how so? And then, you said the ACLU study, of which 2.5 times, the blacks are arrested 2.5 times more nationally and 3 times more in Rhode Island for marijuana, and despite the fact that the usage is roughly the same. I said, really? Okay, and then I knew the statistics that Diego cited in the new Jim Crow about mass incarceration in terms of more people being in jail than in slavery, which is an unbelievable kind of a statistic. And then I said, well, let me listen to you more. And then by the time we got finished, I was off to my next New England Area Conference meeting, and I was able to get the whole New England NAACP to support bills in Rhode Island in terms of the legalization of marijuana. So kudos to you for convincing me to go up there in Boston. To get a whole region up in arms and to act. But I would also like to add that, it's not just 3 times more, but it's the sentencing. Once convicted of a drug crime, blacks are much more they receive much more harsher sentences than whites, which is also not fair. And SWAT teams, they're much more likely to go into black neighborhoods than they are into other neighborhoods, which is also not fair. And then in terms of children, boys with imprisoned fathers are much more likely to possess the behavioral skills needed to succeed in school by the age of 5. We're trying to get more kids to succeed in school, not less. So we got to take away all the barriers that keep our children from succeeding. And certainly, if this is something that's having such a ripple effect on our community, then we have to deal with it directly. I was on the Buddy Nancy show, and he said, well, Jim, isn't this a gateway drug? I said, yeah, it's a gateway to broken lives, broken families and broken communities. You're right, it is a gateway drug, because it's wreaking havoc in my community. And I didn't realize that half the people that are incarcerated, or half the people that are, I guess incarcerated or arrested for drugs, is for marijuana. And I said, wow, that sounds like a very high percentage. You know, I learned so much in the last year that I needed to act because it's a social justice issue. I told him, I said, you want to talk about medical marijuana and taxing? That's above my pay grade. You get other people to talk about that. But I can talk about the unfairness of what's going on in my community and communities across this country because of this prohibition. I can talk about that. And also, the final statistic I want to tell you is that 1 in 9 African American children, 1 in 28 Hispanic children, and only 1 in 57 white children in the United States have an incarcerated parent. So if this marijuana is driving this mass incarceration, which is destroying communities, then we have to deal with this thing head on.
Thank you. So, Elizabeth, I want to turn to you because you're a member of Law Enforcement Against Prohibition, which is a national organization made up of thousands and 100,000, I believe, of former prosecutors, judges, police officers. What is their take on this issue, and why are there so many law enforcement officials that are against the marijuana prohibition?
Well, obviously, because they have firsthand experience, but primarily it's a social justice issue. I just want to get that out there. The organization was started in 2002 by some former cops who, unlike myself, had devoted most of their career to undercover drug enforcement and infiltrating groups of people and then sending them to prison. And they were really consumed with guilt and regret and trying to, set things straight. They're a great bunch of people I've met there. So at least, in my 5 years in patrol, I, as I said, we sort of, just, it was a very low priority. I don't have that to live with, but some of these guys, you hear them talking about how, Jack Cole always says after a while he realized he liked the people he was working on more than the people he was working with. He said, they're just regular people smoking marijuana and their lives were ruined and they spent time in prison and came out and, So it's primarily a social justice issue. I would add that as a former police officer, when we went on, I went on because I thought it'd be an interesting job and I was not at all disappointed, but it really was to serve and protect. It sounds positively naive now in light of what's going on in police departments across the country, but we got to get back to that. It also results in terrible police work. The priorities are all skewed. For one thing, police departments are rated on the number of arrests they make in terms of getting federal grant money. Police officers are also, if their numbers are high, they get a better chance of promotion. And it's an awful lot easier to go out and get arrest a couple of people for drug use than, say, the homicide detective who may have to work an entire year to make one arrest. But when they go up for promotions, one guy looks like he's had all kinds of activity and he's the better cop. But meanwhile, who do you want off the street? Part of the problem also with regards to police work that we've suffered from since the war on drugs is that this has distracted us so much from more serious crimes. And the clearance rate for homicides in this country, across the country, has plummeted since the war on drugs started. Let me see. Homicide clearance in 1980 was 72%, and in 2008 it had gone down to 68%. But more tellingly, in cities like Chicago, it's down to 26%. Those are homicides solved. In Philadelphia, it's down to 40%. And last May, you may have seen a show on Channel 12 News did a report on how are we doing in Providence. And since the year 2000, 43% of homicides are unsolved. So we're filling up the prisons with nonviolent drug users, and we're not getting the murderers. So I live in this city too. I think I'd like us to get back on track with that.
Absolutely. So Mason, I'm going to let you kind of wrap up our discussion here, and I want to just remind folks that we will be collecting your questions on your note cards. So if we can have our volunteers just get ready to collect those and start doing that. But Mason, I want to just turn to you because as a national advocate, you know, you see sort of a much bigger picture. Well, how do you account for this dramatic rise in support?
Well, ultimately, marijuana became illegal and it's been kept illegal based on fear, perception of harm, and that back in the early part of the 20th century, a lot of that was through racism, and racism ultimately is fear. And so we saw a exaggerated perception of harm. And basically, marijuana was made illegal by certain people exaggerating its harm, and that's why it's still illegal, is that people have continued to say it's just too harmful to allow. And what's really interesting is when you look at well, I wouldn't call it evolution because it's, but ultimately the trajectory of arguments against any marijuana prohibition it's really quite fascinating. It started with, you know, there are black men and Hispanic men using marijuana and raping white women. Then it was, if you use marijuana, you're going to go completely insane. You might become a murderer yourself. Then it was, you will inevitably become a heroin addict. Then it was, you're going to be lazy. And then it was, well, marijuana's not that bad, it might lead to something bad. I mean, it's really, you know, they're running out of arguments, but they're doing everything possible to scare people into keeping this substance illegal. And people just aren't falling for it anymore. And a large part of that is the information that's available. When you look at the jumps in support for changing marijuana laws, the first real one was in the 70s, right around 1972, 73, which is when Jimmy Carter was running for president and started talking about this issue and actually said marijuana should be decriminalized. It was really, you know, all of a sudden there was another opinion out there, and when people started hearing this, we saw support go up. And then, of course, that ended, and we saw the Reagan years and Clinton years and so on, and marijuana remained unpopular. But it wasn't until really 1996, Proposition 215 in California, the first medical marijuana law was passed. At that time, what else was happening? The internet was becoming more mainstream. And so all of a sudden, you have people around the country being able to hear about this debate taking place, about whether, not only whether marijuana is bad or whether it's okay, but whether marijuana can actually help people. And so as people started hearing more of this information and hearing this debate, hearing that there are other people out there that support changing these laws, we saw support begin to grow. And that's been really exponential. As states have passed these laws, there's more public dialogue. As there's more public dialogue, people are saying, oh man, geez, my brother-in-law actually supports this, and so does my boss, and I better rethink my position. And all of a sudden, we really started to see people see through all of that anti-marijuana propaganda that they've been subjected to their whole lives. When you think about it, you know, we look at, we talk about how younger people support legalizing marijuana more so than older people. And a lot of times it's seen as, well, they're younger, so that's just a natural thing. Well, I'm pretty convinced that it's because older people, if you're 80 years old, you spent 60 or 70 years hearing only scary stuff about marijuana, and you've only heard the debate for 10 years. If you're 20 years old, you've spent only about 8 years hearing only scary stuff about marijuana, and 12 years hearing that it's actually a debate. So that's really what's fostering this is that public dialogue and people seeing through those scare tactics and coming to recognize that, you know, marijuana is not harmless. It's certainly not harmless, and I don't intend to ever minimize the harm associated with it. But it is far less harmful than many substances that we do consume in our society and we accept should be legal in our society. And people are starting to really get that and recognize that hypocrisy.
Great. Well, I think that's a good note to end on. So if we could have the volunteers come forward. Yeah, let's go. So we're going to take the note cards and we're going to just read them out here, and we're going to let our panelists. So we're just going to have the note cards just to keep it fair. That's the only way to do that.
You have some. I have a two-part question.
So that's not how we're doing it. We're going to have a reading of, so that way it's fair. That way it's
My
everybody
handwriting
gets
is
a chance.
sloppy.
Okay, I'm not going to choose based on your handwriting, I promise. I'm just going to choose randomly out of here. Cool. So because there's no way we're going to be able to get
We're all friends here. Let them ask a question.
I'm African.
Come on.
I'm asking nicely.
This is how we've set this up. I'd appreciate it if you...
Come on. Come on, let the man
Can I
ask
ask
a
him
question.
a
We're all
question?
friends
Look,
here.
if you guys aren't
You let him
down with
run-
how
run
the
this thing
program's
the way he
being
wants
run,
to.
then please leave. I mean, this is how we've set this up, and this is how we're going to do it.
I
It's the
can't
only-
even get answers, man.
Okay.
I live in a community. We don't do this. That's how this rules got
You
started.
can excuse yourself. Thank you.
Well, my question to be answered is what I want to know.
All right, so we're going to start reading from these cards because it's the only fair way to do
My
it.
cards are right here.
I'm sure if it doesn't ask, everyone would probably be happy to speak with you if it doesn't,
Here you go.
I want everyone to hear it because people are more ignorant about marijuana use.
You can put it in here, and that way everyone has the same chance. Please let this program continue. We've put a lot of work into this, and this
I'm
is...
not stopping you from anything, brother. You know what I mean?
All right, so
Just like you.
let's go with the first question here. Okay, so every major political candidate in Rhode Island says that they aren't against legalization, but they have a wait-and-see approach. We've heard that in the election season, and they want to wait and see what happens in Colorado and Washington. What are they waiting to see will happen, and how long do we have to wait before we can act? Does anyone want to take that question?
well, I think that folks who are involved in politics and essentially trying to get or stay elected find a lot of reasons to not take an opinion on things. But essentially, this is kind of like your doctor telling you that you have cancer and you basically sitting around to see if another friend gets cancer and tell you if their treatment works. It's absolutely ridiculous. There's no need for Rhode Island to wait and see what's happening in Colorado or Washington or Oregon or Alaska. Rhode Island is not Colorado, Washington, Oregon, or Alaska. Rhode Island is Rhode Island. And Rhode Island is going to treat marijuana how Rhode Islanders and their elected representatives think it should be treated. It's not going to be the same as it will be in California, much like alcohol laws are very different from one state to another. So it's really, it's dodging the question, but I think that what we're seeing is that the sights are set on this. I mean, the spotlight is on elected officials. They're being forced to talk about this more than ever before. Whenever they sit down for an interview in a state like Rhode Island, in a state like Colorado, it is inevitably one of the questions that gets asked, and that was never really the case. So they're going to run out of excuses soon enough.
Great. Okay, so we've got another question here, and maybe this would be good for you, Dr. Lewis or Mason. What are the horrific outcomes of recreational marijuana use? I guess horrific is kind of a strong adjective there. I guess maybe what's the worst that could happen is kind of another way of phrasing that.
Well, I think that is much less common than alcohol, but it's like alcohol. Would be injuries. Would be not in the category of disease or crazy behavior. Although there is some claim that if you're schizophrenic, prone, it can sort of tip you over a little bit. I think the most of it's going to be the injury and injury prevention. There seems to be rather less risk with marijuana in terms of driving than alcohol. Doesn't mean it's safe. It doesn't mean you should drive under the influence of marijuana. You shouldn't. But it looks like with alcohol, people sort of speed up when they get drunk, and marijuana, they sort of slow down when they get. So there's some interesting differences for comparison, but I think the area of injury, which is a very important area, is one that the recreational user still has.
Do you have something to add, Mason?
Yeah, I would just say that with any product, there are going to be some harms associated with it. We all agree peanuts are a nice snack. If you are allergic to peanuts, they can be deadly. We all appreciate that we have access to cosmetics or household cleaning products, but then a kid gets into them and that's not good. With marijuana, it's not for everyone. And we actually have launched a campaign called Consume Responsibly, which is in the states that have now made it legal for adults, that highlights the potential harms that there could be. And while they're relatively limited in scope compared to alcohol, they're there. And you know, Dr. was referred to people with underlying mental health conditions. That is certainly an area where we see it could be problematic. People who have underlying addiction issues or a family history of addiction, people who are suffering from respiratory conditions, liver conditions, are all potentially at heightened risk for having complications, and they should be aware of that. And that's the thing, is that, you know, we need to be focusing on making sure those people are aware of that, not just telling every adult that it's going to hurt them.
All right, thank you for that. So this next question, I'm going to read it, but it will probably be more appropriate for the next panel. It's asking, if marijuana is legalized, regulated, and taxed, would any tax dollars be mandated to funnel into addiction and recovery efforts? And so we're going to deal with that question in the next panel. The short answer is essentially yes. There would be some money set aside for that, but we'll go to another question. What classes at Brown School of Medicine cover the endocannabinoid system? Do you know of any of those, Dr. Lewis?
The pharmacology lectures. I mean, it'd be standard introductory pharmacology.
Actually, there are
You'll speak to the reality.
There are none. There are no classes at Brown University School of Medicine that touch on the endocannabinoid system, which.
So cannabis isn't.
But no, we have endogenous receptors in our bodies.
Right.
That receive
Yes.
endocannabinoids that we make, that are retrograde messages in the endocrine system, in the immune system, everywhere. It's a major, for human health, everywhere. We need cannabinoids in our body to be healthy. And a lot of the diseases that you see are like scurvy to vitamin C is cancer to
Right.
cannabinoids.
Well, I think the receptor, as far as I know, nobody avoids talking about the receptor systems, because that's one of the most exciting things we've learned about the brain. And the fact that there are these receptors give us a lot of information about how drugs work and how anti-drugs work, basically. And it's particularly the case with the opioid drugs, but it's also true with cannabis.
So this question is, it seems like only recently there have been cases of marijuana overdose. Can you talk a little bit about that? So maybe this is referencing some of the cases in Colorado. Do you want to talk about that, Mason?
Yeah, I assume that this might be in reference to infused products, edible products. I don't know if anyone wants to identify themselves as the question, but I assume that's going to be the case. To be clear, there's never been a confirmed marijuana overdose death in history in terms of someone dying purely from the use of marijuana. What we have seen in Colorado is what we have seen in Colorado and everywhere else around the country and really the world forever, which is that if you use too much marijuana, it can be incredibly unpleasant. Generally, the effects of over-consuming marijuana can be a heightened heart rate. Obviously, it's a very unpleasant sensation. Typically, if someone goes to the emergency room for having consumed too much marijuana, they're given a mild sedative, they're put in a dark room where they can just really wait it out. But ultimately, this is something that has been in the news more obviously because we are seeing this debate taking place, and it raises an important question. While there are probably far fewer people who quote-unquote overdose on marijuana in a year than quote-unquote overdose on alcohol in a weekend, it is still something that we should be keeping in mind. When I say overdose, I mean hangover, drinking a little too much. But the problem is that we just don't have as much of a cultural knowledge of marijuana. The Maureen Dowd incident, this is the big, well-known situation now. Maureen Dowd came to Colorado, she was given a candy bar, she was instructed to eat a certain amount and to wait a certain amount of time. she ate a certain amount, she didn't wait long enough, she didn't feel it, so she ate more, and then she had a very bad reaction. She would never have shown up and had a martini and just after 10 minutes said, you know what, I don't feel that, let me have 5 more. Because she knows, she's been around alcohol her whole life, and that makes sense. When it comes to marijuana, people are not as familiar with it. They might hear that, you know, you should only eat so much. They might see a wrapper that says 5, 10, 25, 100 milligrams of THC. That doesn't necessarily mean anything, and that's why we're really focusing on educating people about those things.
Yeah, that's a real statement of the need for a public health approach. So if you don't know what you're taking, or its strength, or its effect at a high strength, which we know about marijuana because we've given artificial THC in higher and higher doses. We know exactly what happens at the very high doses. It's not pretty, it's not good. You wouldn't want it to happen to you. So I think that that's an argument for regulation, but you also have to understand that what's happening in the regulated situation is you have oral use, not smoked use, forms of marijuana where it's harder to control the dose. That's something we learned from what's going on in Colorado, Washington, eventually Oregon, and Alaska. So you do learn something from that, and there's going to be some public health restriction on the dose of those edible forms of marijuana in response to what we learned. And that's the way it ought to be.
Okay, so I know we're going to have to get to the next panel. We're going to do one more question. I just want to let whoever wrote this know it was a question about what type of system of regulations would we set up. We're going to be again talking about that more specifically in the next panel. So the last question we have here, and maybe Jim or Elizabeth, if you want to step in, does religion? Do you think religion plays a heavy part in the maintaining of prohibition of marijuana? Either of you have that sense, or anyone want to jump in?
I don't.
Okay, simple answer.
I just have no thoughts on that at
Okay.
all. Could I take a minute?
Well, I know that.
Dr. Lewis got to give an assignment, and I'd like to give an assignment. He didn't get
Sure.
to civil asset forfeiture, which is an evil that predated the war on drugs, but just got totally pumped up, and particularly in 1980, it was given teeth. Just Google John Oliver and civil forfeiture, and the YouTube will come up. It's hilarious, but it's horrifying. And I have some handouts that I'll put on the table out there.
Alrighty, well, that wraps up this panel here, so let's give a round of applause for our